Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. On today's episode, we are joined by Dr. Sibyl Knight and Dr. Joshua Fischer, two remarkable osteopathic physicians who are redefining patient-centered care in California. Dr. Sibyl Knight is a board-certified osteopathic physician specializing in osteopathic manipulative medicine and breastfeeding medicine, whose unique background in religious studies brings a deeply compassionate, holistic perspective to healthcare. She has built her career around belief that healing encompasses both scientific rigor and the human spirit, dedicating herself to traditional osteopathic medicine, women's health, and maternal care, and approach that honors each patient's individual journey. Dr. Fischer brings a fascinating blend of clinical expertise and innovative thinking to medicine. Triple board certified in family medicine, neuromuscular skeleton medicine, regenerative medicine, he has carved out a unique niche, combining regenerative medicine, interventional pain management, and traditional osteopathic care. His journey from microbiology research to Washington State University to osteopathic medicine in Touro University reflects his commitment to evidence-based, non-surgical treatments that help patients achieve optimal function without invasive procedures. Together, they have co-founded the Osteopathic Way, where blending cutting-edge regenerative therapies and time-honored osteopathic principles. But more than business partners, they represent a new generation of physicians who refuse to accept the status quo of rushed appointments and symptom-focused care. Today, we will explore their personal paths to medicine, the philosophy that drives their innovative approach to healing, and their vision for what healthcare can become when practitioners truly put patients first. Welcome to Health Tech Heroes.
Thank you so much.
Thank you so much for having us.
It's my pleasure, and I'm so glad both of you are here today. And let's start with a question, how both of you actually arrived here. So can you each share a transformative moment, whether personal or clinical, that led you to pursue osteopathic medicine and eventually co-found the Osteopathic Way?
There was one moment that really led me to become an osteopathic physician, like a traditional osteopathic physician. I will say my first year of medical school, I definitely started to see the possibilities, I guess, of traditional osteopathy. I found myself in the OMM lab very frequently, treating people over lunchtime, hanging out with my OMM professors a lot. And I just became really inspired by them and realized that it was even a potential career, because when you're in medical school, whether it's osteopathic medical school is different than allopathic MD school in that we all train in osteopathic manipulation. And I think a lot of people are really surprised to find out that all the DOs in the whole country have done about 200 hours of osteopathic manipulation training, regardless of what type of specialty they wound up in. When you're in medical school, there is kind of like this pressure to find your specialty in order to apply to residency at the end. And I went through a whole slew of things that I thought I wanted to be: a pediatrician, a surgeon. I went to medical school thinking I wanted to do emergency medicine because my pre-med research was in emergency medicine. And I didn't even really realize that this was a potential career. So when I figured out that I could make a living just treating people with my hands, I immediately started to go, is this really something I would like to do? And contemplating it. And eventually, by my fourth year, I was pretty set on it. I knew that that's what I wanted to do. I came from a long line of entrepreneurs, so I wasn't scared about starting my own business, which limits a lot of doctors in terms of this profession, because there aren't a lot of big facilities that are going to hire you to do osteopathic manipulation. There are a few, but I knew going into it that I was going to probably have to run my own business. I think my first year of medical school really started to solidify that for me.
It's awesome. And Dr. Fischer?
Like Sibyl's was like a accumulation of things. When I first went to medical school, I thought I was either going to be an anesthesiologist or I was going to do orthopedic surgery. And between my first and second year of medical school, I actually herniated 2 discs in my back, wakeboarding. And I had this injury. I was up in Seattle. I went to see a bunch of different surgeons, a bunch of different doctors. Mind you, I'm like 22 years old. And they're telling me I need to have spinal surgery. And I had the whole thing. I had pain down my leg. It was really painful. And I thought to myself, man, 22, I really don't want spine surgery. I'm going to go back to school. I'm going to see if I can find some way to do this without surgery. And when I got to school, one of my professors saw me walking down the street and he was like, what happened? And I told him a little bit about the injury. He said, why don't you bring your MRI to my office? I'll check you out. And if I can help you, well, he did. He looked at my MRI. He said, I don't think you need surgery. I think we can fix this. And I don't have any pain today from that disc. And that sort of set me on the path. I still thought I wanted to do orthopedic surgery. The end of my third and fourth year, I did 6 months of orthopedic surgery rotations, spending just all that time in the operating room. And what I noticed in the operating room and in clinic is that there was a lot of people who came to an orthopedic surgery office and realized that, like, hey, there's a lot of people here that don't need surgery, but they're not getting the greatest care, like musculoskeletal care. And I knew I was passionate about musculoskeletal care at that time. And I thought maybe I can find a way to incorporate osteopathic work, traditional osteopathic work, with some non-surgical things that were coming up like PRP. And so I started kind of working my way down that route. With all that orthopedic training, I knew how to do most of the injections by the time I was done with my fourth year. I actually, at the end of my fourth year, did a PRP injection for one of my professors under ultrasound guidance. That was my first one. That was my first one I ever did, is in 2013. And it's kind of just been off to the races since then. And so here we are.
So your first patient was your professor, huh?
Yeah. My first patient was my professor. It was pretty wild. Sybil was there. And he got better. It was great. Like, I was so excited.
He had a lot of faith.
No, that's good.
Yeah.
And he graduated, yeah.
We were in his room in his house. Remember in Vallejo?
It was like his treatment room, and he had like been complaining to me about this shoulder pain. And I said, look, man, I've done these injections before. I've done PRP. Like, I did one with an attending there present, right? I said, I just need an ultrasound machine. If you give me an ultrasound machine, I'll do it for you. And I got a text a couple of weeks later. He's like, I got it. And so then we went and did it in his treatment room in his house. And he had been doing PRP for a while. So that was a big inspiration for me as well.
That's fascinating. The stories that go behind your origin story. So I want to step back a little bit further, right? And it's a tough question. So is it possible you can connect your young self to the osteopathic philosophy? Because I'm not 100% familiar with the osteopathic philosophy. But first of all, like, why did you get into healthcare, right? There has to be, like, you are coming from an entrepreneur background. Why specifically this? We could have like sold iPhones. I could have made a lot of money. But why healthcare? And
I think that's
going
a great
back
question.
and connecting it to the philosophy that you're living right now.
I got into healthcare because of my mom, actually. My mom had really severe asthma when I was a kid. And when I was about 7 or 8 years old, my dad was out of town. He was traveling for work. She woke me up in the middle of the night and she was blue, like fully blue.
Yeah.
And she's like, she couldn't talk. She was just like scribbling on a pad and said, call 911. This is the address. And so I called 911 and medics showed up and basically saved her life. Her pulse ox, if you guys are all familiar with pulse ox, her pulse ox was 84. And I'll never forget looking at that pulse ox when they put it on. I didn't know what it meant, right? But 84. And I looked at the paramedic. I said, is that good? And he said, nope. And he put oxygen on her and gave her breathing treatment, got her in the ambulance, and they got her to the hospital. And she's fine. Like, her asthma is much better controlled. The other thing was my uncle was a pharmacist. And so that was my original motivation of going to Washington State, was they had a great pharmacy program. I thought I was going to be a pharmacist. When I got there, I realized that I really loved microbiology and immunology specifically. I remember talking to one of my advisors and he's like, why are you doing this? Like, this is way more work than you need to do to like become a pharmacist. And I was like, I don't know. I really like it. And I'm glad that I did all of that training in immunology because I use it every single day. And it's really like changed how I look at healing and regenerative medicine and all of the things that I use on a daily basis. And even my lab, like the research that I did there, I use a lot of those skills in how we operate our lab in the office. So that's how I got here.
That's how old were you when this incident happened with your mom?
I think maybe 8 or 9.
By the way, two of my favorite subjects were microbiology and immunology.
Yeah.
It's a super coincidence. And what's your story?
I always ask him, I'm like, tell me this about immunology. I can't remember. Like the B cells and the T cells. I took a really roundabout path to medicine. I was always really into science as a kid. I was a math and science nerd. I went to school at UCLA as a chemical engineering major, and I had no idea what I was getting myself into at all. And when I got to school, I realized I didn't have the type of work ethic and like study. I'd gone to public school in California, so I had just kind of breezed through school. It was always pretty easy for me. I got all my work done. I took my AP classes. But then when I got to the engineering program at UCLA, I kind of hit a wall of I actually have to study in order to be able to pass these classes, and I'm not sure that this is what I want to study that hard. And so I ended up changing my major to study religion, mostly because I just loved it. And I was like, I need to get a bachelor's degree and I need to study something that I like in order to do that. I had taken one class in the history of religion with the professor who was the head of the department there, and we had hit it off. And so I changed over to a Bachelor of Arts in Study of Religion, and I kind of like left science behind for a few years. And then I just kept circling around healthcare. I thought maybe I wanted to become an acupuncturist for a while. I thought maybe I'd get my master's in public health for a while. And eventually I was talking to my boyfriend at the time's mother about it. And she said, "It sounds like you just want to be a doctor." And I was like, I don't think I can do that. That just seems really overwhelmingly hard. And I hadn't taken a science class in a while. So that conversation just really planted the seed for me. And I was like, well, maybe I could become a doctor. Do I want to become a doctor? And I decided to take a biology class my fourth year of college just to see how it was going back to the sciences, and I killed it in that class. I got like an A plus and I hit it off with the professor, and I started to think, oh, maybe this is possible. So, and I crammed a whole bunch of summer school the summer after my fourth year because I had run out of credits at UCLA. I couldn't take any more classes, but they were like, if you want to take classes, summer school doesn't count over your credits. So I think I took like 20 units that summer in science. And then I did well. And then I just circled my way through. When I first applied to medical school, I applied to MD schools because I had never heard of osteopathic medicine before. And then somewhere along the line, I found out about DO schools, and I just realized I was really into yoga at the time. I was practicing every day. I was really into biomechanics and anatomy. And I just said, oh, well, this sounds much more holistic. It sounds much more up my alley, using the structure of the body to help treat the function of the body. And so then my second time around, I only applied to osteopathic schools. And that's how I kind of wound up on the path. But I don't know why healthcare was calling me. My family owns a carpet business. I don't come from literally no healthcare in my entire family, except for I think my great grandmother was a nurse during the Spanish flu. But yeah, everyone's like a librarian or a carpet person or a salesperson. There is no healthcare in my family. So it was just calling. I could feel it. I feel like this is what I'm supposed to do for some reason.
I'm trying to link like corporate business to healthcare, and I'm finding it difficult.
Yeah, no.
Right. But what I also find fascinating is if you look at the carpets, the patterns, and they're probably already designed to look at complex designs and make sense of it and see beauty in such complexity. Saying that it almost feels that when you look at a patient compared to beginning of your journey and being accomplished osteopathic doctors right now, you probably see the patients in a different light than I do or most people do. Is there a way we can even step into that arena? That how do you see a patient and how that perception has changed for both of you, that the patient is not an individual sick person, but it's someone more than that?
Good question. I do find that osteopaths in general, and really I find that anyone who treats the body with their hands on a regular basis has experiences that you can't really explain via science or medicine necessarily. I mean, we do have a framework for it in osteopathy. We really adhere to the idea that the structure of the body is very, very important to the function of the body. And it makes sense, right? Even on like a vascular level, if you're getting clogged arteries, you're not getting blood flow. If you don't have lymphatic drainage, you're getting swelling. It's all, even when you get down into the microcosm of cells, if you look at some of the studies, they show that when the cells themselves are under a physical stress, they actually read the DNA differently and create different proteins. So the structure being kind of foremost in our minds is part of our practice. And over the years, you have people who I guess I should back up a little bit and just say, Dr. Fischer and I, we're married. I don't know if you know that, but we're a couple. And we have always been good at looking from a different angle than other people. When we have patients walk into our office, often those patients have already been seen by many people. They've been seen by orthopedic surgeons. They've been seen by a physical therapist. They've been to the chiropractor. They've been to the acupuncturist. They've done a whole bunch of physical therapy. And we really focus on putting everyone else's opinions aside completely and trying to look at the patient with very fresh eyes, because our philosophy is always that stuff didn't help you. So why would we pay attention to what everyone else has said about your condition? And just starting there and really looking at them with fresh eyes, we're very focused on doing physical examinations, whether it be orthopedic or an osteopathic type of examination. And that gives us a lot of information that most doctors are missing these days just because of the way that medicine has gone. But once we started to get CT scans and MRIs and X-ray became much more regular, the physical exam started to die. And we find that that's true all the time. I mean, we have people who come in who say they need a hip replacement regularly, and we fold their leg all the way up and they have this fantastic range of motion in their hip. And we're like, why do you need a hip replacement? They're like, I have pain on the outside of my hip. And we're like, okay, but did anyone look for like a glute med tear? Did anyone look for something outside the hip that's the problem? Because it seems like the hip joint itself has...
Or the back.
The back.
Yeah. I mean, how many times is that the case, right? Like
all
lumbar spine refers to the hip. And that's one of the things we find all the time is like people get hip replacements. They end up in our office and their pain is no better. And we look at them one time and we're like, well, it's coming from your back. Like we looked in the wrong place. Healthcare as an entity looked in the wrong place to begin with. I agree with Sibyl. Like we look at it definitely from like a different perspective. I can remember one thing that really changed how I look at patients from when I was a first year intern or second year, actually. I was treating a retired osteopath. His name was Lou Hasbrook. And he would come into the office, I would work on him, and he would ask me about my patients. So he would like take time. He's getting his treatment, but at the same time, he was also training me. And I started telling him about my patients for that day. And he said, I think you're looking in the wrong place. And I said, what do you mean by that? He goes, well, you got to look at the health first. He said, find the health and start from there. And that's a completely different way of looking at patients, right? So even from like regenerative medicine wise, right? If someone comes into me for a regenerative medicine consult, I'm looking at their overall health, right? Do they have diabetes and all of the other things that are contributing to their microscopic health? So if I'm trying to get a tendon to repair, I know that their body is it's only going to repair as well as their body can. Like I can only do so much. The rest of it is on their body to do the rest.
We also look at the biomechanics of the entire body, which I think is very different. I'll watch someone walk across my office and maybe they have neck pain. But when I'm watching them walk, I'm going, oh yeah, your hip on the left is up for some reason, and that's creating a lumbar curve, and then that's putting stress on your thoracic spine, which is putting stress on your neck. You're having like an anterior head problem. So we treat the entire body every time we see someone. It goes head to toe. So if we find like a fascial restriction in one area, we're tracking that all the way down the body as best we can. It's a much more global perspective. Of course, with orthopedic type medicine, you have to look like that. I don't really understand how we've like parceled it out into just the shoulder or just the hip, because of course, the hip isn't just going to degenerate for no reason. It's probably because you've been walking funny on it.
How do you look at people and anyone's perspective that I know, right? Basically, how you look at a patient. It's a broken shoulder or it's a whole patient. I think you have answered the full question that the origin of the issue is not necessarily where it ends up. And the way you look at the patient, it has to be holistic. And that is a word that I believe you have also used in your website and things, I think very completely applies. So that actually brings me to the osteopathic way. First of all, what is the philosophical reason you named it the osteopathic, the company itself? It's more like a sentence than a
Clinic.
a clinic, right? And what is that unique thing that you bring that no other clinic brings? And double clicking on that, no other osteopathic clinic brings to the patients.
We named it the Osteopathic Way because we wanted it to be a roadmap, like the place you go that's a roadmap to health. So you come to us for a shoulder problem or whatever it is, right? And we're going to guide you in the correct direction so that your body can heal. And that was the whole origin of the Osteopathic Way.
That's a good one. I like that.
Yeah.
That's what it was.
I believe you. Yeah.
Two of us are new fans of Osteopathic Way here.
Obviously, the osteopathic philosophy, we have definitely branched into things that we didn't anticipate when we started the osteopathic way, but we really feel like it's still encompassed by osteopathy. Well, the osteopathic philosophy, especially regenerative medicine, there's basically 4 tenets of osteopathic medicine, and I'm sure I'm going to butcher them, but one is that the body is a whole mind, body, spirit. The second is that the structure and the function are importantly related and you can't separate them from each other. That the body can innately heal itself, of course. That's like that's where I was going with the whole thing. So regenerative medicine is just kind of building on those philosophies. We're still taking parts of your body, autologous stem cell procedures like bone marrow or lipoaspirate or platelet-rich plasma, which is from your blood, and we're taking the healing cells and we're concentrating them and putting them back in your own body. And so we're actually using the body to heal itself, just like the osteopathic philosophy, which is that the body wants to heal and it just has these dysfunctions that are in the way that we're trying to get out of the way so that you can innately heal. And I think that that's actually a philosophy that medicine in general has forgotten. And I used to see it a lot in the hospital when I worked in the hospital as a resident, which was we bring sick patients into the hospital when they're acutely ill, and we forget that we're literally just trying to say they have sepsis or something. We forget that we're trying to just get their bacterial load down to a place where their body can heal itself. And we're just kind of watching and supporting them while and hopefully not doing too much else to them, although that's debatable now. But we're trying to just get them to the point where their body can heal itself and then they can leave. And that's the root of all of our practice, is like you have the capability to heal these things that you might not even think is possible. But we're going to be here supporting you and helping you and trying to get whatever dysfunctional patterns you have in your body, whatever, if you have a calcified tendon that's in the way, if you have a meniscal tear, if you have a fascial restriction, we're going to try to get that out of the way so that your body can really take that and run with it and heal and be healthy.
I think the last part of your question is like, what is it that you do differently at the Osteopathic Way? And I think what it is that we do is we can easily recognize the things that will get better with hands-on treatment. And we also know the things that will not. And for those, we lean on regenerative medicine.
Our surgeon friends.
And sometimes they're surgeon friends, right? Like there's a time and a place for surgery. And you have to know where that time and place is, where hands-on is not going to work. And it's a whole thing. Like you got to figure that out. And that's why patients get better. And it's
Absolutely
the balance between the two.
I think we're a little different than the average osteopath even. I mean, I know we are.
Oh, yeah, for sure.
We don't really mess around. We treat everyone with our hands. And we treat them head to toe. But we don't really mess around with like, we're going to treat you 10 or 20 times and have you complaining of the same thing. If you're not feeling a significant change at visit 3 or 4, we're diving into different things. We're getting MRIs, we're doing ultrasound diagnostics, we're thinking regenerative medicine, we're thinking whatever it is, we're going deeper. We're not going to sit there and wait for you to magically heal with our hands if it's not really working. So I think that's where we're kind of funny is our practice is named the Osteopathic Way. We really believe we adhere to osteopathic principles and philosophies. And also we don't fit in the osteopathic category as much as we're kind of in the middle. We don't really fit in the orthopedic category or the regenerative medicine physician category because of the osteopathy. And we don't really fit in the osteopathy category because we also believe in all this kind of all these orthobiologic procedures that we're doing.
That kind of answers some of the questions that I had based on our conversation. But one specific question is, you have this core traditional values, the osteopathic way, but also you're really innovative, and that innovation has led to a next generation PRP that you have developed within the clinic as well. So my question to you is, what are those non-negotiable traditional osteopathic ways that you truly don't negotiate on? And how does that actually become a platform for innovation, develop further? Innovation is inevitable, but how do you marry these two concepts with the non-negotiable traditional values?
For me, it always comes back to the patient. Like I started looking for a better PRP because the PRP I was doing, like this is I started in 2013. I did PRP in residency until 2017. And then early 2017 to maybe 2020, that was when I really started like saying, man, I'm doing a good amount of PRP and I'm not getting the results that I necessarily want for my patients. And so I started down a path of trying to figure out, how do I make this better? Because I know some of my patients get way better. Like some of them get way better. I know they get better. I see them, we track their functional outcomes, like they're getting better. And then there's a subset that don't. And why is that? And that was the original question with PRP is like, how come some get better and how come some don't? Let's figure it out. And so way we started developing our PRP in our office, we got a CBC machine. So that was my original thought was, hey, maybe I'm just not giving the patient enough platelets. Maybe that's it. And so I started concentrating my platelet count higher. Sometimes I went too high. Patients would get a flare. They have a little more pain. They would eventually get better, but it was this balancing act of trying to find the right number for the right indication. And what I found is that really every indication is a little bit different. You have to treat it a little bit different with a little bit different concentration of platelets. And then also looking at the actual cell lines that are concentrated in the PRP, which you can change based off of how you actually concentrate your PRP. So like the centrifugation process, you can change which ones you get. So that's how we started with PRP. I saw a gap in my patient care and I wanted to fill it.
It is very osteopathic, to tie it back to your question, because the originator of osteopathic medicine, the founder of osteopathic medicine, A.T. Still, was an MD in Missouri in the 1800s. And the whole reason he founded a whole new type of medical school and medical training was because he was looking at his colleagues treating things with mercury and cocaine and not having a good way to fix broken bones and that type of issue. And he went, I think some of these things I can treat with my hands if I know the anatomy well enough. And he just kind of started from there and started to look at medicine from a totally different lens in direct response to the MD medicine at the time. And I think that's where what we do essentially is we're very questioning of everything. We like to go to the sources for everything we do. I mean, we don't really do family medicine, even though we're both certified in it, board certified in it. But due to the nature of medicine now, a lot of people don't have family medicine physicians anymore. And so we wind up doing some family medicine work. You know, we look at people's labs and we give advice on medicine. So we are always trying to look and see, you know, here's the recommendation, but what does the literature actually say? Here's our experience of this. is this in line with what the algorithm says we should do? Is this going to work for this patient based on their lifestyle and their concerns or their comorbidities or whatever? And so we're always kind of questioning things. And that's, I think, how we go along. It's just kind of the nature of our personalities is we're like, is this really, I mean, they're telling us that this is how you do it, but we know, we've already seen it. We've been in practice for like 8 years. And already they have totally different diabetes drugs than what I learned when I was in residency.
Exactly.
It hasn't even been a decade. And they have totally different cardiology tests that they're using regularly. They're using a lot of calcium scores and more specific lipid tests that are breaking things down more extensively than the previous generation. And so medicine is constantly evolving and changing. And I think a lot of physicians get stuck in like, well, this is what the American Academy of Family Medicine tells me to do. And this is what Up to Date tells me to do. So this is what I'm going to do. But they don't really stop to think about what they're doing. And I think that that's kind of dangerous because we're all going to see medicine shift over the course of our careers, like extensively. So we probably should stop and think. But again, other doctors don't have time to do that. So I also understand why they're not, because they're working in a big facility. They're seeing a patient every 5 to 10 minutes. You don't have time to stop and be like, am I really going to prescribe a statin for this patient? Like they have this history and that. So it's just the nature of medicine right now, I guess.
That was a really deep answer. It will take time for me to really think through it because the way I see it is a lot of people like who are highly trained, especially highly trained people, tend to do it like this is how I've been trained. This is what the book says. This is what my professor says. This is what my mentor has said. And we don't move away from that. Time could be a factor, as you pointed out. A hospital setting could be a factor, and there could be many other factors, but you have released yourself away from these factors a little bit.
Well, I think that what's interesting is I find as a doctor, and I'm pretty sure this is a somewhat universal experience, but we have such a long period of training that I have things in my brain that come up and I'm like, I don't even know where I know that from. Like I just have that in my mind. Like some attending pimped me on that, like when I was a 4th year medical student or something, and it got stuck in there. And what I find is that's when I start to go, is that really right? Because I don't even actually know where that came from. And some of the doctors I worked with over the years, I don't particularly admire as doctors. So if they were the ones that shoved this little nugget into my brain, do I really want to go with it? I remember when we graduated from residency, one of the big things I noted was I found 2 studies when we were first in practice. And I don't even remember. I think I used to receive a journal from the American Academy of Family Physicians or something still. And I would like just peruse it every once in a while. But I saw this study on how normal saline in the hospital was actually causing acute kidney injury in a lot of patients. And I was like, what? Because we put everyone on normal saline. Like we don't think of, when I was in the hospital, we didn't really ever think about that as a possibility. But then I was thinking about all the patients I'd seen in the hospital who had ended up with acute kidney injury. And we were like, why is this happening? They don't have a history of any kind of kidney issues. But all of a sudden, after they've been in the hospital for 3 or 4 days, their kidney function tests are showing acute kidney injury. And then that was a moment when I really started to go, my gosh, I think I need to really examine everything I've learned in medicine because that's something I didn't even think to question ever.
Okay.
That was just part of what we do.
Dr. Fischer, you have a take on it?
I was trying to think, like, why is it that we're okay doing, like we're looking at things and questioning things? And I think it comes back to our mentor in residency. His name was Joel Stein. I talk to him all the time, actually. He's a great guy. Joel was great because he was always open. If you went to him with a thought, he never was just like, no, that's wrong. He was like, why do you think that? And I think like those discussions that him and I would have, or Sibyl and him and I would have, were really like formative in why we're like, we look at things maybe in a different light. Like it's not just what the academy tells you to do. It's also like the science is here. Maybe it's not completely solid, but that's okay. Let's see what happens. Like let's move forward with that.
But isn't that kind of the entrepreneurial mindset also, you think? Because I feel like entrepreneurs in general are people who are willing to look at things and find a problem with how things are done and want to like put in a solution of some of their own.
Absolutely. Yeah.
We like to live life on the edge a little bit.
That looks like it. Yeah. Question everything. Yeah, my wife questions everything I do, but hey, makes me live on the edge. Building a practice centered on holistic, regenerative, and functional medicine isn't easy because as I see it, you are actively cutting out a revenue stream, like the family medicine. That could be a good revenue stream. So you have made some tough decisions, and being in a hospital is probably in a big organization is easier than being an entrepreneur. Perhaps less rewarding, but easier, perhaps. What are the challenges you have to overcome? What is the biggest mindset challenge that you had to overcome to have this clinic and have a successful purpose-built clinic?
There's a lot of
There's
challenges.
been so many.
You have at least two opportunities. What comes to your mind first?
Well, obviously the biggest challenge right now with everything is insurance.
Okay.
When we started our practice, we were pretty committed to having a cash-based practice. I got pregnant the week we started our practice with our second baby, and we both looked at each other and went, we were working urgent care at the time to fund our fund starting our clinic.
Yeah.
And we wanted desperately to get out of urgent care before I had the baby. So we decided then and there to start taking Medicare. And eventually we started to take TRICARE as well, which is the active duty military insurance. Because we were in Monterey, and Monterey has a couple of schools there, Naval Postgraduate School and Defense Language Institute. So there's like a large population of active duty military members there. And so we started to take these two very government-based insurance plans. And it went well. We filled up fast. We were able to quit urgent care. I was able to take some maternity leave. It worked. And now we're 6 or 7 years down the line. And this year we found that we had to stop completely taking Medicare because they just kept cutting our reimbursements every year. So every year we were getting a 3% cut of our reimbursement in the midst of massive inflation and the price of everything going up. And so we decided to go non-participating with Medicare this year, which basically means that Medicare patients can still see us. They can still get most of their visit reimbursed by Medicare, but they have to pay us, and we bill Medicare, and the Medicare reimburses them. And we're able, because of that, to charge slightly higher than Medicare rates. I can't remember, it's like 10 or 15% higher. And in that process, we've lost a lot of patients because we had some Medicare patients who were coming to see us really regularly, and they stopped. So I feel like that's kind of been our latest challenge, but we've had entrepreneurship is not for the risk averse. We've had many moments where we've been like, oh, we feel like we're kind of jumping off a cliff here and we don't know if we're going to make it, but we think this is what we need to do. And then we do it and then it works out fine. But
Yeah,
it's always that.
Stopping Medicare, when we came to that realization, it was really a choice. It was like, okay, I can either cut my amount of time that I take to see a patient. So we take, for a new patient, we take about 45 minutes with a new patient, which is a long time. It gives us a chance to really dive in and figure out what is the source of this person's problem. And then for our follow-ups, we do half an hour follow-ups. So we take a good amount of time with our patients. And the choice was, we can either cut that time in half and keep doing what we're doing with Medicare and the insurance reimbursement, or we can, I knew that going forward, if we cut it in half, they were only going to cut us again at some point. They're going to continuously do it. And at some point, you're going to get to a point where you have to see a patient every 7 minutes. And that's just not a sustainable way to take care of patients for me. And for me, it was really kind of like a moral thing. Like, do I think this is right? Like, to take care of patients that way? No, I don't. And so we went over that. It's like, yeah, I knew it was going to be a challenge, and it is what it is. Like, at least I know at the end of the day when I go home, I'm taking care of my patients in the way that I think is best.
Two important things that I heard very clearly, and I want to pin that, is the word that Dr. Knight used, that we were desperate to move out of urgent care. The desperate, I think that desperation has to be there to be an entrepreneur. It's not like I want to move out of urgent care. It is the desperation of moving out. I think that was really powerful. And what you're saying, Dr. Fischer, is like basically, hey, I can't justify my services to you in 7 minutes.
Yeah, absolutely.
So you're probably better off somewhere else than being here. I need those 45 minutes. I need those 30 minutes. That's my that's where I can help you. And that's a beautiful thing. And that's a big sacrifice to make. Thank you very much for that. So your unique focus is newborn and maternal care, regenerative medicine, and musculoskeletal health. What are you most proud of? Like, how do you measure successes osteopathic way? Say, for example, you're sitting at a dinner table with your extended family, and if there are a couple of cases that you want to talk about without, of course, identifying the patients, what are those cases that you talk about?
Well, we never talk about cases with Josh's parents because his mom doesn't like us to talk about medicine. She gets a little squeamish. Anytime a patient gets better, obviously, is the best.
It's a win.
That's the best. And that's why I'm amazed that there aren't more osteopathic physicians, honestly, because there's nothing like being a doctor when your patient walks in and like can barely get up on your table, and then you treat them and then they hop up off the table and walk out, which rarely happens that significantly, but does occasionally happen. It's just so rewarding. You're just like, oh, I don't have to prescribe you medication. I don't have to send you anywhere. I'm just going to I'm going to see you one more time to make sure your body doesn't go back to that pattern that was giving you grief before. And yeah, it's just wonderful. For me, I do see babies. I see pregnant ladies. I love breastfeeding medicine purely out of my own experience of having trouble breastfeeding. Of course, with my first baby, I realized, breastfeeding medicine is its own thing. And they really don't teach us anything about it in school. They teach us about mastitis and how to treat it. And that's kind of like the whole thing. It's always it's just like wonderful to treat babies. They're so vibrant and like full of life, and their bodies shift very easily compared to adults. They're not so calcified and stuck in their patterns. So it's always fun to treat babies, but then to watch a mother's life literally improve because her baby is able to latch in a non-painful way, and she feels like the baby's getting fully nourished by breastfeeding them, and they don't have to supplement with formula anymore. They don't have to pump and then try to give the baby more milk. Those postpartum time is so hard in our society today anyway, because we've really walled ourselves off into like, we don't have a community anymore to take care of us in that postpartum time. And so any shift that makes their lives easier is just so grateful. And I'm so happy with it because I know that it's really transforming their lives. Just to have a baby that can breastfeed successfully is a big deal. They're getting more sleep. They're less stressed. Everyone's stressed, especially if a baby's not gaining weight. Oh my gosh. Everyone's stressed about it. The pediatrician's stressed about it. The parents are stressed about it. Everyone's like, the baby's not gaining weight. Oh my gosh, it's not growing. So that's always wonderful. But I feel equally as passionate, I guess, about my adult patients when we have a win. If I've diagnosed them with a glute tendinopathy and I send them over to Josh and he sticks PRP in it, and then I see them 6 weeks later and they're like, oh, I'm able to hike again, or oh, I'm able to surf again, or I'm able to go to my kids' soccer games or coach my kids' soccer team. That really affects people's lives when you can shift how they use their bodies and what they're doing with their bodies. And it shifts their entire health too, because if they're only able to sit down and then they go back to being able to do these activities that they love, their mood changes, their blood sugar changes, their high blood pressure changes, everything changes for them in that moment. So it's just a very rewarding aspect of medicine to be in, I think.
Allowing the body to do it too in most cases.
Absolutely.
It's not that you're going in there and like changing something drastically in the patients that may have other consequences. It is you're letting your body to heal.
We get that comment all the time, right, Josh? We have patients who come in all the time who are like, I didn't think you were really doing anything. I didn't really feel like there was much going on, and I just kind of laid there and went with it. But then I went home and, like the next day I woke up and I didn't have back pain anymore, or my neck didn't hurt anymore. And I don't know what you did. Like, what did you do?
That's an analogy I was just telling my son. He says like, Dad, you're a really good driver. I think I'm a pretty good driver. And like, what's the secret? He said like, my dad once told me that if passengers are in the car, they should not feel that you're driving at all. Like that has to be
That is
that
great advice.
That's smooth.
As someone who's really scared about being a passenger in a car, that's like...
And if they don't even feel that you're driving, they feel safe, they feel good, they feel refreshed. and they're not stressed out when they get out of the car. And I think that was the secret for me. I think it just kind of like two different conversations from decades apart connected with me. And what's your take on this? Obviously, not at the dinner table with your mom, but with, say, Dr. Knight's
Maybe a different dinner
parents,
table.
yeah, in a different dinner table.
I love when someone comes to me and they have seen everybody and everybody else got it wrong. Like, not that they got it wrong, but they weren't able to help that patient because those patients, they've been through the whole system, right? Sometimes I have people that come in and they bring me a stack of paperwork. And I'll go through it and I'll try to get to the bottom of it and figure out what it is. But when I can help those people and get them like back to a state of living, right? Like they can function, they can do the activities they want to do. That's awesome. That's one of my favorite things. And I am also really proud that Dr. Knight and I are going to start teaching how we do this. Because I think when we first started our practice, we actually scaled our practice to be like pretty large. At one point, we had 4 providers in our practice and we were seeing a lot of patients. And I was trying to teach those doctors to do what I do. And because I thought, hey, if I can teach these doctors to do what I do, then we can help more patients, right? But now what we're going to do is we're going to teach other doctors that are not part of our practice. And we can teach way more doctors and all of them can help these people that maybe wouldn't have been able to find anything that helped them. So I'm pretty excited about that for the future. And I think, if we can start training some doctors to think a little bit more like us and to use some of the technologies that we've developed, I think that's the future of like regenerative medicine and our vision of healthcare. Yeah, but I think if we can just help more people, that's like a win.
Looking ahead, spoke about future. What do you think are the most revolutionary things that are going to happen? You see is going to change because of all the technological changes. Even you said like in diabetes, there's like 10 years ago, the treatments were so different. And now I think that is going to be like supercharged with the technology and information sharing and analysis. Where do you think it's going to go? Like from healthcare, it's going to go, or the osteopathic way is going to go in like next 2, 3, or 5 years?
I don't know if anyone can answer that question because we're all sitting on the edge of the AI revolution going, what exactly is going to happen with this? I know in terms of, I'll let Josh talk more about regenerative medicine because he's really the regenerative medicine nerd of the practice. But I am really interested to see, I think we will definitely have some chronic diseases that are cured. Our son has type 1 diabetes. And I've already seen 2 very promising studies come out in the recent months regarding like CRISPR technology and changing beta cells to where the immune system doesn't recognize them. And so I'm actually amazed that my son in his lifetime may have type 1 diabetes cured for him. I think that the state of the healthcare system in the United States is so terrible. And I think that there's going to be a huge shift of some kind. We have so many patients who can't access care for one reason or another. Usually, even if they have insurance and good and decent insurance, there aren't physicians available to see for them. We find it all the time. I can't send someone to a dermatologist here. It's like a year-long wait to get into a dermatologist. Sometimes there's a huge mid-level provider situation now where we have a lot of PAs and NPs practicing in specialty services, which is honestly very frustrating as a physician who's board certified in family medicine, because if I'm sending someone to a specialist, I'm trying to get that specialist to give me an opinion on the patient. I'm not trying to send them to a nurse practitioner who hasn't been through a residency program. And I see it all the time, especially online with physicians. There's just doctors leaving medicine in droves because they're overworked, they're underpaid, they're having bad patient outcomes, they're forced to supervise providers that they don't want to supervise and sign off on charts. And I think that the patients are starting to get really frustrated by the whole situation. The doctors are frustrated, the patients are frustrated, the medicine costs so much money and everyone's paying an arm and a leg for insurance that has a really high deductible. And there's going to have to be a reckoning of some kind that happens. I don't know what it's going to be. For me, I personally think my ideal solution would be to make everyone cash based and have physicians take a certain percentage of a sliding scale patient population. Like if I'm cash based and the government said, oh, but you need, 15% of your patients to be sliding scale based on what they can pay, I'd be like, okay, great. Like bring them in,
Yeah.
but I doubt that that's the way it will go.
It is probably 85% might be on the sliding scale patient wise. It is.
Well, I mean, maybe not. I mean, I think it will have to go more localized than it is now in terms of insurance, at least. Like, I think insurance will have to be more local
Catering to the-
insurance, but I don't know what's going to happen. But I think the healthcare system is already toppling the way it is.
Yeah, it
and
is.
there's so many patients just who are being totally neglected.
Or they slip through the cracks of the system.
They get misdiagnosed.
All of that. Like, for me, I always tell my kids this. Like, if they're trying to do something, I always tell them, hey guys, slow is smooth, smooth is fast. And that comes from like my grandpa and way back in my family. I think healthcare could really learn from that. We try to do things so fast in healthcare. We try to see a patient in 7 minutes in a lot of these large clinics. And is that really the most efficient way to see a patient? If you have to see a patient 15 times for 7 minutes to get what I can get done in 45 minutes, I think I'm doing better.
Yeah,
So I think
As much money.
I'm not making as much money. You're right. But I'm saving the healthcare system a lot of money if you look at it
That's
like
true.
a global perspective, right?
I would like to see more collaborative care. I think that physicians in general have kind of walled ourselves off from the physical therapists and the chiropractors and the naturopaths. We're kind of like, oh, you're over there, you do functional medicine, you're trying to find the root cause, you're doing all the GI testing, whatever. But there's a reason that patients are going to these providers instead of the conventional doctors. And I have seen some really wonderful results from patients changing their diets or going to acupuncture or doing kind of alternative things. And obviously, like, I'm more open-minded to alternative things in general, but I really think that in order to have a healthcare system that takes care of patients to the best of our abilities, we would have like a team, of people. So I always recommend to patients, I go, look, I know you don't want to, because we live in a particularly like hippy dippy area. So I always say, I know you want to do the alternative stuff. I know you want to do homeopathy. I know you want to do acupuncture, whatever it is. But conventional medicine is really good at making sure you're not going to die. That's where we're trained really well. To this day, I am an osteopath and everything, but I'm still looking to see, does this person have cancer? Does this person have a brain tumor? Does this person have a fracture? Do they have osteoporosis? Like, my mind is always still rule out the bad stuff first. Let's make sure that like the big things that are going to really affect your life or possibly kill you are out of the way before we go down just trying to treat your hip with regenerative medicine or whatever it is. So I think if we could look at patient care a little more holistically like that, where the conventional doctors were there to run all the regular conventional tests and rule out the really scary, terrible things and potentially scary, terrible things before someone goes and sees their naturopath or their chiropractor or whoever it is that they want to see, then that would be just so much more efficient. Because what I have happen now is people go to their whoever it is that they trust and they spend a bunch of time with them trying to do weird things because that person isn't trained in hospital-based medicine. And then they walk through we've had this. Josh, I used to call Josh the cancer whisperer because he diagnosed so much cancer for a period of time there. We see a lot of cancer because people will initially present with back pain if they have METs to the spine. We are big on like getting the imaging, looking at it, making sure there's not something really wrong. So that's where I'd like to see healthcare going, is like everyone understanding that they need a whole team of people. They can't just see one person and expect that person to be kind of the end all be all of their health. And then them participating as part of the team, I think would be my next wish because we've gotten to this point now where people just go to their doctor and go, fix me. fix me. I'm broken. I have this random thing that's happened to me. It has nothing to do with any of the decisions I've made in my life. And it's not helpful. It's not a helpful situation. The patients in our clinic that have that attitude get weeded out real fast, because Josh and I are like, okay, but what are you going to do about it? Like, what are your
100%.
plans? Are you going to start to walk? Are you going to go to physical therapy? Here are the steps. Are you going to increase your water intake? Like, what are you going to do to help yourself? And if people don't want to do that, they leave.
A lot of people probably come down to say that, hey, give me this tablet that I can take every day morning and I don't have to do anything else and just live my life the way it is. That's not going to help them in the long run at all. They
No.
might feel better, like
Maybe.
symptom-based treatment.
It costs the healthcare system so much more money. I'm like, what if we had a national healthcare system and they paid for who people actually wanted to go to? What if they paid for the naturopath to work on people's diet and gut and use supplements, and they paid for acupuncture, and then we'd probably end up spending way less money on acute care in the hospital, because maybe people would get there. They wouldn't get so sick.
I think this also includes the idea of preventive care. So we are basically sick care, that people are actually sick before we take care of them.
Yep.
But the healthcare should start from there, saying that like, hey, man, you're going to be 40 years old. They're going to be 50 years old. So let's take care of you before you actually get sick. We can do that proactively. I think that will be another big step, healthcare, hopefully. So I had two questions. The main question is, what is the mindset they need to bring to be successful in this, I think, suboptimal situation for clinicians to have their own clinic in a situation like this? What would be your key advice? And to that, just add anything that you think is important that I might have missed through my questions, or you think is important to reiterate. So I'm combining like 2 or 3 questions together. Advice for leaders, advice for entrepreneurs, or anything you want to end the podcast giving audience some advice or some information. With that, the stage is yours to go first, and Dr. Fischer second.
Sure, yeah. The first thing that pops into my mind is always keep your overhead low. That's the way to start. We get that question actually a lot from our colleagues, like, how did we start our practice? Because it just seems like such an overwhelming thing to do, both financially and in terms of all the tasks you have to accomplish, and maybe the insurance contracts and stuff. And we started our practice with a $15,000 loan from my parents. And so we started in one room that we built. Well, Josh and my brother built pony walls in to make into like an office space and a patient care area. And that's how we started. And we automatized as much as we could. We started in 2017 and we just went, where can we use technology? We want to be pretty paperless as far as our office goes. What EMR can we use that will keep the paper low or non-existent? Can we use technology to help us answer phones? Can we use technology to help us schedule patients? Let's just systematize every process we can and try to keep the overhead just as low as possible. And that's how we got out of urgent care and were able to really like start our practice. Over the years, of course, our practice has become a much more complex beast. And it's been interesting the past couple of years, because we actually went from having, like he was saying, we had 4 doctors, including us, and 2 offices. And we've gone back to just having one office, the 2 of us, and our one medical assistant, office assistant, who does everything for us,
Wow.
Katie.
She's the best.
She's the best. Yeah. So we've found for ourselves that has really been the most ideal situation. I think that that's what I always give people advice on when they're starting a practice is really try to envision what you want your life to be, what you think is really important in terms of your own time. Do you enjoy managing people? We didn't that much. Or do you enjoy seeing patients, or do you enjoy the business aspect? Like, what part do you enjoy? And really try to focus on making that happen. For us, it's always been hanging out with our kids. We always are trying to make sure that we have time to see our children. And so the way we operate now is one of us drops off the kids and one of us picks up the kids every day from school.
Wow.
And that's been our goal from the beginning. So could we potentially make more money if we both worked 40 hours a week? Yes. But that's just, kids are 7 and 9. And we know that time is precious. And we've just decided that that's really our priority. So whatever your priority is, try to just keep that in mind and keep things as simple as possible and as low overhead as possible.
Thank you very
Yep.
much.
The only thing I would add to that is when you are starting your practice, the first 100 patients are the most important because it really takes about 100 patients that have gotten better to go and tell the entire community. That's it. So make sure that you are doing the right thing. Always make sure you're doing the right thing for your patients, but be very careful with those first 100. Make sure that you're figuring out what the problem is, finding the solution and helping them get back to their health. And if you can do that, you're going to be successful.
Well, I would add to that also, as a physician, I find that the most empowering thing is to be okay with apologizing that you don't know something. I often see patients and they have some weird symptoms and I'm like, honestly, I have no idea what is happening with you, but I'm going to go talk to my colleagues who I have on speed dial and try to figure it out for you, or I'm going to look it up for you, or I'm here as a partner for you trying to figure it out. And I think that patients love that. They hate it when their doctors are like, I know the way, and then they don't get better. It's so frustrating. You pay all this money, you spend all this time going to see a doctor, and the doctor's like, well, what you need is this. And you go, I don't think that that's what I need. That doesn't really seem right. And the doctor says, nope, that's what you need. And so, just be willing to be in more of like a partnership with patients. Some patients are going to like that. Like I said, the patients who want you to just prescribe them a pill that makes them better aren't going to like that. But, there's something really powerful about being just there for people in their time of need and able to say, I'm not exactly sure what is going on with you, but we're going to figure it out. We're going to do this step and this step and this step to try to figure out what's going on with you.
Wonderful.
Couldn't have said it better.
Yeah, absolutely. This brings us to I cannot appreciate enough Dr. Knight and Dr. Fischer, that how amazing this has been. And as I said, I'm changing as I talk to people, and this is a huge leap for me as well. And in this area, and really understanding where you're coming from. And thank you very much. I really can't appreciate enough how much it has meant to me. And with that, thank you.
Thank you. Thank you so
you.
much.
Thanks for having us. This has been awesome.